China is fighting the nation's worst outbreak of the coronavirus in the past 2 years. The official number of reported cases is still relatively low, about 32,000, according to the government. But a significant portion of those cases have been the highly transmissible Omicron subvariant known as BA.2. Mainland China reported 2 COVID deaths on Saturday. They are the first since January 2021. Officials are responding with sweeping shutdowns in many large cities. In Shanghai, the streets were empty Saturday as businesses closed and people stayed inside. Ben Cowling joins us from outside of London. Ben is the head of the Division of Epidemiology and Biostatistics at Hong Kong University. Professor Cowling, welcome. So let's just get some context. First of all, you hear 2 deaths. It doesn't sound like that big of a deal, but these are the first deaths in mainland China since 2021. Tell us, how much of the Chinese population is vaccinated and how concerning is this?
The vaccination rate in mainland China is about 85%, which is very high. But in elderly, in some parts of the country, it's as low as 50%. So there is still a lot of concern about the potential impact of a larger COVID epidemic.
And Professor Cowling, the Chinese government's strategy in the past has been really to seal off these outbreaks. Is that a realistic strategy in the long term? Has that been working, and at what costs?
For the last 2 years, they've done very well in stopping outbreaks while they're still small. Don't let them get into big outbreaks. Stop them while they're small. The numbers at the moment are bigger than they have been in the past. I think they'll still be able to stop the current outbreaks, but it's getting more and more difficult as COVID gets more and more transmissible. BA.2 now is extremely transmissible, so it's going to be difficult to keep this going.
So you're mentioning BA.2 and how extremely transmissible it is. It's even more transmissible than the original Omicron variant that was so virulent. It seemed like everybody was getting it, and we were getting notifications constantly that we were in touch with people. How does the impacts of BA.2 compare to other strains of Omicron, to Omicron and other strains of COVID that we've seen?
Well, I couldn't tell you the difference between BA.1 and BA.2, but in general, Omicron is a little bit milder than other strains, but it's not that mild in people that are not vaccinated and older. In Hong Kong, we've had a lot of infections, probably 3 or 4 million BA.2 infections in the last 2 months and 5,000 deaths already. So that shows the impact that even BA.2 can have. We think it's mild. It is mild if you've got immunity from vaccine or from infection. In mainland China, many older people don't have either.
That's a very important point that you raise, that it is mild if you are properly protected. Chinese officials just now seem to be promoting more targeted policies like using at-home test kits. Why has China been slower to adopt some of these prevention strategies?
Well, if the objective is still to really stop transmission and stop an outbreak in its tracks, the best way is in China to test everybody with PCR, to isolate all the cases that are found, to quarantine their contacts. I think the rapid test may just be a short-term measure in the part of China, in the northeast of China, where there's been a large number of cases in recent days. I don't think it's really a long-term switch in policy. I think it's just a temporary measure.
All right. Ben Cowling, thank you so much.